Thank you for joining us across the fence. I'm Keith Silva. Whether it's choosing us to snack on a piece of fruit over a piece of candy or taking a walk, health and wellness always seem to be on our minds. A new effort is underway between the University of Vermont Extension and the UVM Larner College of Medicine. It's called Health Heroes Community Workshops for Youth. And with me today in the studio are two of the organizers of that program and a couple of heroes in my book. Margaret Coan is a 4-H educator with UVM Extension, and Leila Amiri is the Associate Dean of UVM Larner College of Medicine. Thank you both for talking with me today. How did this partnership start, Margaret?
Well, I have to say, Leila reached out to Sarah Kleinman, who's the director of 4-H, which is who I work with. We work with youth, and wanted to have opportunities to bring medical students into the community and working with youth. So we have Leila to thank for reaching out to our director in 4-H.
And no better place to find youth than Vermont 4-H.
Exactly. Exactly.
Why did you want to specifically reach youth? Why was that your target audience, Leila?
So we've realized that in the students who apply successfully to medical school, generally their interest in medicine arises sometime in the K through 12 period. And so that was really our target audience. Having that information and seeing that that was the largest group of students that we admitted to our College of Medicine, it seemed like a perfect opportunity to reach out to our local students here.
And what you're also looking for is you're trying to reach out to Vermonters specifically, so.
Oh, totally. Totally.
Helpful.
Totally. We're a public
very
institution committed to the citizens of the state.
That's right. That's right. Okay, so I understand what the students are going to get out of this. What about medical students and doctors? From every TV show I've ever watched, they're pretty busy people. So what are they going to get out of this?
So we have a social justice mission within the core of the foundation of the College of Medicine. So part of it is really giving back to the community and that feeling that you have from doing good where it needs to happen. And also it's our future workforce. So our faculty and staff and our physicians will have individuals who hopefully will be within their ranks at some point.
And is part of the goal here, hopefully, that you're going to get someone who is in a more rural area that then may be interested in coming to UVM, coming to school at Larner, and then going back to that rural area, or at least staying in Vermont? Is that kind of the other goal here?
That's the hope.
Okay.
Individuals from rural communities continue to remain underrepresented in the ranks of medical education across the country, and so pulling from those communities is a target for us.
Excellent. I don't want to let too much time go by without letting our viewers know when these workshops are going to take place and what the topics are that are going to be covered. So here's the listing. The first one comes up at the end of this month, March 30th. Careers in Healthcare. Seems self-explanatory, but what can you tell me about that workshop? What are you looking forward to do there?
Well, we would love to get youth exposed to all the variety of jobs that are in healthcare. So people know doctors, people know nurses, but there's also physical therapists, there's physician assistants, there's counselors and psychiatry. So there's so many ways to be in healthcare. So we want youth to understand that it's not necessarily going to take 11 years. If you want to be a doctor, we're excited about that option. But there's so many other ways to be in healthcare. So we want to expose youth to the variety and also to people who are in those different majors. So there'll also be some UVM students, for example, in nutrition and food sciences.
Okay.
So there's a lot of different ways to enter into healthcare. And they'll get a chance to talk to the students, so hear firsthand what their pathway was, what are their interests, what kind of classes are they taking. So there'll be some hands-on activities as well.
It's a great point that it's not just doctors and nurses, and I don't know if the mics picked up, but we heard you laughing when Margaret was saying not every profession is 11 years, but that's the other thing that we're talking about here is medical school is quite a commitment for certainly the higher, but what are those jobs that are less than 11 years? What are some of those jobs that aren't such a commitment?
I think Margaret touched on them. So when you think about the support team that's there to help a physician take care of their patients, I mean, nurses come to mind. There's all of the technical staff that are there, radiology technicians, there's phlebotomists, there's x-ray technicians, all of the individuals that come in within that continuum as well. And so the idea is to introduce students to this entire web of healthcare.
And these are good paying jobs, right?
Oh, absolutely. Absolutely. These are all professional positions, and they're
Right.
with a lot of continuity and opportunities for growth as well.
Excellent. As a reminder, these workshops are for students grades 8 through 12, and the second workshop takes place April 4th on the topic of prevention strategies. What's a prevention strategy?
Well, we want to talk about, there's so many things that could be counted as prevention. One of the goals is to help youth understand that choices that we make in our daily life can affect our health. So we want to be really explicit about what are those things that can enhance our health and wellness. So giving youth strategies that they can implement, that they can then take home and share with their families, their friends, potentially do their own programming in their schools with things that they're most excited about. So we want to also support youth in that area so that they can bring forward what they learn.
Diet, would that be a prevention, eating healthy?
Right, so nutrition, so the choices that you make. So we have water we're drinking here today. You didn't give us Dr. Pepper, you gave us water.
I didn't.
So that might be a choice that we could make in our daily life that can help our wellness. And that's a simple one, and we want to go into a lot more that youth can actually control in their lives.
Right, good point,
Choices
that they can control. And also maybe it gets back to mom and dad. I know that's a big thing we talk about with 4-H is different things that happen. It gets back to mom and dad that they're doing this or learning about this. I'm sure we'll upset all the dairy farmers out there that I served you water instead of milk.
You didn't serve us milk.
Oh well, that's a
That'll be
good
for
strategy. How is it on the doctor side? This is such a big part of going to the doctor now, is wellness, is prevention. Are doctors being taught about these strategies, Leila?
Oh, completely. It's woven into the entirety of the curriculum as an understanding in whole health and holistic health, and also educating of patients. And so when an individual comes to the physician's office after having established habits, it's really hard to break those. But if we can capture young individuals before they've even developed those habits, and even more importantly, they have the language and they go back home and talk to their families about it. I mean, think about just something as simple as sunscreen. I mean, this is an outdoor state, and people are outside a lot. And so one of the things that we see a lot in rural communities is skin cancer. And so a small act of putting sunscreen on can help prevent that. And so it can start from the young people that come to our workshops, hopefully, and they can take it back home.
The lights are pretty bright here on the set. I did not offer you suntan lotion as well, so my apologies. Last but not least, and this is one I'm really interested in, Saturday, May 4th, may the 4th be with you, you are covering mental health. A reminder to our viewers that these workshops are free, but they do require registration, and it's first come, first serve, so don't delay. Mental health, this seems to be the big topic du jour. We should be talking about it more. It is being talked about more, so it makes sense to have these workshops center on mental health, but you didn't have to, so why?
I mean, it's exactly what you mentioned. It's the topic du jour. Our young people are suffering. And so how can they be aware of mental health? What strategies are there? How can they develop resilience? How can they protect themselves? And if they need help, where can they go for that? And what are signs of, that a person may be struggling a little bit mental health wise? So I agree that that's a really important topic for us to cover, and to cover that early.
We were talking about prevention strategies being part of the curriculum. Mental health, sort of the same, obviously part of the curriculum, but one thing that doctors try to stress a little bit more nowadays is seeing someone, counseling and things like that.
Yeah, destigmatize that.
Destigmatize it, yeah, good
Exactly.
point. Margaret, with the 4-Hers that you work with, I mean, you're not necessarily talking about mental health when you're, it's a club meeting or, a horse show or something like that. But do you hear the kids talking about that sort of thing?
Well, I would say youth are really great about talking about mental health. They seem to have less fear around talking about it than maybe some older people, like in my generation. And we want to make sure that they have adults that they can also talk to. So helping adults talk about mental health. And frankly, mental health is part of whole health. So, we separate it out, but it's really part of whole health, and youth are ready and wanting to talk about it. So we are going to talk about simple strategies around mental health as well, and prevention strategies for to keep mental health from deteriorating for youth.
Mental health is health.
Yes.
We're just about out of time. Part of the goal of these workshops is to get the doctors to be in audience with the kids and the kids to be in audience with the doctors. What do the kids get out of this? I said before, what the doctors get out, but what do the kids get out of this, Margaret?
So the youth who are attending, hopefully they will get a view of multiple careers that might spark their interest. They will get strategies they can use in their daily life to enhance their overall health, so that includes mental health. And they will be excited about learning something new and bringing it back to either into their communities, so that they will get a chance to sort of be the teacher as well.
Exactly.
Once they're learning some of these strategies.
And you said there's going to be hands-on opportunities. It wouldn't be 4-H without hands-on.
Exactly, yes.
Awesome. Well, thank you very much. Health Heroes Community Workshop for Youth is open to children in grades 8 through 12. It's a free event, but space is limited. Register at the website on the screen or go to go.uvm.edu/hheroes. That's heroes with 2 H's. My thanks to everyone here at WCX who made this program possible. And as always, thank you for stopping by Across the Fence. I'm Keith Silva, and as Jolie likes to say, have a good one.